Good afternoon or good morning, depending on where you are in the country. This is the HMIS lead webinar. We'll get started in just a couple of minutes. While we wait, I'm just going to put up our virtual code of conduct for you all to review before we get rolling. Thanks. All right, let's go ahead and get started. Few housekeeping items. Want to make sure you all know that you can turn on live closed captioning. You will do so by going to the lower left-hand side of your screen and clicking on the little arrow next to that CC icon, and then you can choose your preferred caption language. Everybody except for the panelists are on mute today. You'll use the chat feature to interact with us and to send in questions. We'll go over that a bit more in detail in the next slide. Please see the HUD Exchange website for all of the materials for this event from the past and current and going forward. You can also subscribe to the HMIS lead listserv from that site and find other links to HMIS information. And that's also where you would submit an ask a question or AAQ. Intermittently throughout our time together today, we will be dropping a link in the chat to this Weebly site. On that site, you will find all of the links associated with the slides and their slide numbers. If you have questions for us, you can go ahead and submit those questions in the chat. Please send them to all panelists. Once they're submitted, we copy that question into a shared document where we work together to draft the answer for you. If you don't see an answer to your question, please rest assured that we have it and we're working on a response. Sometimes it takes a little while to pull that together for you. Also, if we answer questions verbally, we will summarize that answer and post that in the chat during the meeting. We do our best to answer all the questions that we receive during the call. If we get to the end of the call and you've asked a question that wasn't answered, we will try to stay on the call and answer as many questions as possible. But if we run out of time, we will address those unanswered questions in the Q&A document that's posted after the webinar. Sometimes this won't be feasible due to the volume of questions, and even just sometimes the questions are of such a specific technical nature that we will ask you to submit the question through the AAQ so that we have more time to focus on it and get you the information that you need. You can save the chat from this call if you don't want to wait for the Q&A to come out on the website. So you just go to clicking the file button on the top toolbar and then you click Save Chat. You do have to do that before we end the webinar. So when we get to the end, I will pause for a little brief time to allow you time to do that. If you're not sure if you should be on this call, here's the kinds of things that we use the call for. We use it to share upcoming events, information, and changes to guidance, provide broad overviews of guidance and foundational knowledge, Provide a forum for questions from the field, remind communities about upcoming reporting deadlines and requirements, and providing leadership for implementation success, all related to the homeless management information system. Here's our agenda today. So we're going to start out with announcements and reminders. Then for the deep dive content, we will be looking at the new eligibility form in Sage. We're going to talk about some minor changes to the HMIS CSV. And I left a note in there to invite Gwen, which thankfully I did do. So that's great news. We're also going to get a demo of the Data Standards Interactive tool, and then we're going to talk about data exchange and interoperability. In our Did You Know section, Alyssa's going to go over some information around data use agreements, and then we will finish up with William talking about why isn't there a national HMIS. Lastly, we want to hear from you all about what you would like to hear about in those but why segments that we do with HUD. Here is our cast for the call today. So we have William Snow from the SNAP's office, he, him. From App Global, I am Jesse Jorstad, he, him. We also have Ureli Salgado, she, her, and Miriam Carlone, she, her. From Cloudburst, we have Max Burns, he, him, and Stacy Matthews, she, her. From ICF, we have Alyssa Parrish, she, her. And from PCL, we have Meredith Alspa, she, her. For guest speakers today, from App Global, we have Tanya D'Souza, she, her. From ICF, we have Gwen Beebe, she, they. Also from ICF, we have Grant Tuioti, he, him. And from USDS, we have Ai-Chi Lu, she, her. Cindy Noe, she, her. And Ellen Trinkline, she, her. All right, for announcements and reminders, I'm going to pass the mic over to William.
Thanks, Jesse. All right, let's start with welcoming our new system admins. We know there's quite a bit of turnover in the field still, and you, if you are new to this call for the first time, may feel like you are swimming in some deep waters. So there is a lot to do in the HMIS space, but there are lots of resources as well. So we encourage you to access these resources. We have links here. We can provide links later as well. You can always use the AAQ if you have questions. We would expect lots of questions if you're new to this space, so please don't be shy about them. We would much rather receive questions from you than you receive questions from us. Those tend to be a lot more painful experiences. So we are excited for you to join us and look forward to hearing some questions from you either today or in the future. Next slide, please. All right, what do we got on deck for reporting? We have a few things. The SSVF reports, monthly uploads, that's coming up just a week away. So the 1st to the 7th. We also have the ESGCB CARES reporting due. That would be not necessarily for everyone, just those who are continuing to report. So we know that many recipients have actually wound down and are no longer reporting. So again, if that's you and you're wondering, oh shoot, do I still have something? No, if you've wound down and you've closed out, this isn't a reopen an APR kind of deal. This is just a reminder for those who have not submitted. YHCP quarterly reports due July 30th. Special NOFO quarterly reports, again, if it applies to you, due July 30th. And then the RAI quarterly reports as well, available from the 15th to the 26th of July. So lots of quarterly reports, not surprising, a lot of that closes at the end of the month. The HIG PIC count submission, it closed, but we are moving into the fun phase of cleaning that data. We will have lots of fun questions for you. We usually reach out to just about every single COC. I don't think this year will be any different. So we anticipate reaching out to you. Be prepared for that. If you're not sure if you are signed up within HDX 2.0 as the contact, I would try to log in, make sure that you're knowing if you have access to the data and if your information is in it, then we likely can reach you. And again, we're going to be reaching out to probably every COC. We'll talk a little bit more about that with Tanya's help in just a minute. Next slide, please. Upcoming events. All right, Data Analytics On Demand course. That's been really great. A lot of great reactions, especially this is like a heads up for you new folks. This is a really good course to take. The registration will open July 8th. So we encourage you to look for the email to register and sign up quickly. In the past, that has actually filled up really quickly and has been unavailable for many who wanted to access. This is why we keep providing it. So encourage you to sign up for that. NHSTC, the Summer Virtual Institute, please register for that. That's coming up quickly on July 17th. We know there's a lot of summer things going on. This will be another one. We'll talk a little bit about data exchange and some of the fun things that we're working on there. Should be a great, great day. So sign up for that. And then finally, October is going to be here before you know it. We know this summer is just going to fly by. We look forward to seeing folks in Portland, Oregon for the fall NHSDC conference. Next slide, please.
Well, thanks so much, William. You're all done.
Awesome. Thanks.
You did a great job. All right. I did want to mention before I go to the next slide and I'll talk about this at the end of the call as well, but because the Summer Institute for NHSDC was scheduled on July 17th, which would be our normally next scheduled HMIS call, we moved our call to the 18th. So put that in your calendars and we'll see you then. Okay, over to Tanya.
Hey everyone. I just have a couple of quick slides here to reiterate some of what William just said. First, I just wanted to say thank you to everyone who submitted their HIC and PIT in May, and highlighting that I do believe there will be a feedback session to talk about the HIC and PIT in HDX 2.0 next month, so be on the lookout for that. And we, of course, have already identified some fixes for the system and started implementing those, and are looking to do a bunch more improvements for next year. Next slide. So the HIC-PIC data cleaning process has just launched. As with prior years, this is an opportunity for COCs to engage with our data cleaning team to answer any data quality questions and request any needed edits to the data. So you all, if you are a primary in the HDX or someone with submit rights for the HIC or PIT, likely already received an email from our team with a couple of questions about your HIC or your PIT, just to verify the data or request corrections to it. If there are additional things that you've noticed in your PIT or HIC that you would like cleaned, this is the opportunity to do it. So our data cleaning team will be responsible for making all of the edits in the HDX 2.0. So you just need to tell them what needs to be updated and they can go ahead and get that taken care of for you. The data cleaning process typically lasts about a month. So like I said, you probably already got the email from your review team. If you haven't already responded to that, just let them know that you received it and you're working on it. And that'll be really helpful for us to make sure that we've got the right people on those emails. Like I said, we'll work with you to get any corrections to the data made before they're finalized and used for the AHAR Part 1 report. And that is everything. So if you have any questions about that, let us know. You can put it in the chat and I'll be answering those questions. But otherwise, please feel free to reach out to your assigned review team and they can help you answer any questions that you have and take care of any cleaning that you need.
All right, thanks so much, Tanya. We'll also have some members from the HIC team on the call next month to do a feedback session about the data collection process and also the data cleaning process. So looking forward to that. Meredith.
Thanks, Jesse. Hey, everyone. I just wanted to come on real quick and do just a real quick reminder about YHDP, so Youth Homelessness Demonstration Program. I think hopefully everyone is familiar with YHDP at this point, but it was brought to our attention that there were some recipients out there in the communities that didn't realize they had reporting requirements and even didn't realize they had data collection requirements. So I just wanted to put out there a little reminder, a little something for everyone to just remind you all YHC recipients, subrecipients in your communities, beginning with round 4, have to do quarterly performance reports, QPRs, for all projects except for coordinated entry, HMIS, and planning. I also want to note that the QPRs and their due dates are generated in Sage based on the operating start date. And QPRs are due if there is an operating start date, even if clients haven't been served. And I think that's maybe been a point of confusion for some folks as well, where maybe they've had an operating start date set in ELOCs, but they haven't actually began serving clients yet. Sage is going to start triggering QPRs based on that operating start date. So if you have an opportunity, if you're out in your communities, having your regular meetings, talking to them and whatnot, please check in with your YHDP recipients. Please make sure they understand they have QPR reporting requirements. And also, please make sure they know how to run an APR CSV and a hashed HMIS CSV. The hashed HMIS CSV is used for supplemental reporting requirements, and that's going to be used for the QPR and the APR. So please just check on your YHDP buds out there. That would be great. Thank you.
Thank you, Meredith. All right, the Stella M team rolled out a new product here recently. One of the things that communities need to do if they're working on system modeling with or without Stella M is to estimate the cost of different project types. And in order to help you do that, that team has created the Stella M project cost calculator. So you can find that on the site that's linked here in the Weebly site and check that out. All right, it's time for these deeper dives into content. Gonna go back to Meredith.
Sorry. Excuse me. I was trying to answer some of the questions that were about, I'm going to answer them out loud, if that's okay, Jesse. So this new program eligibility form is only applicable to APRs. It is not applicable to QPRs. So there's one question, check. And YHDP recipients log in themselves to do their quarterly and annual performance reporting in Sage. So y'all don't have to do that reporting for them like you did in ESGCB. They do their own reporting. Okay. So now let's talk a little bit about the new eligibility form in Sage. And this is, this is one of those things that, are you all having to complete this form? No, it's not applicable to HMIS reports, but this is one of those things that you will get asked about. We know you will, and we want to save you some headache and heartache of trying to figure things out and get ahead of it for you all, hopefully, and help you understand what the expectation is. Of course, we're available for help, but we just wanted to let you know what this was all about. So a listserv went out a couple weeks ago. This form became applicable, became live in Sage on June 1st. It is called the Program Eligibility Form. And what we're trying to do with this form here is deal with APRs that are getting rejected or returned to recipients because when the APRs are being reviewed, HUD's not able to determine if the clients are eligible for for the programs in which their clients are being served. So this is applicable to COC programs, YHDP programs, special NOFO programs. In order to be eligible for those projects, clients must be meet the definition of HUD's definition, of homelessness at project entry. When those APRs are being reviewed, HUD's looking at Q15. So there is a question in the APR, Q15, living situation. That is the living situation at intake. And there are a lot of times very reasonable reasons, right, there, and completely logical reasons where someone's living situation at intake is not a homeless situation. However, it's not always clear to HUD if that person is actually eligible for the project or not, right? So in the absence of any additional comments or any additional clarification from the recipient, those reports are getting returned to recipients. So with the program eligibility form, what we've essentially done is taken out that requirement to add additional comments in a separate part of Sage and tied it directly to Q15. So what they'll see in Sage, I'm going to skip ahead. Oh, sorry, I'm not going to. What they'll see in Sage is, which we'll see in a second, is literally the living situations, the number of people, and then the ability to write a comment directly associated with those living situations and the counts of people. Again, hoping to minimize the back and forth and just streamline the reporting process a little bit more. Again, this is going to be applicable to YHDP, COC, and special NOFO funded projects. It's going to be applicable to services only, street outreach, transitional, rapid, joint, and permanent supportive housing. So again, we're not talking about coordinated entry, we're not talking about planning, we're not talking about HMIS. This is going to be a form that all new submissions and resubmissions will see in their launch pad. So if you've got a report that you submitted, let's say last week, and you know didn't have the form, or last month you didn't have the form on there and it gets rejected, when you go in to do your resubmission, there will be a new step on there and it will look like this. There will be this little thing here that says program eligibility and it will say missing. For those of you that do, I know some of you do also complete these project level APRs on behalf of recipients. You will see that this is missing in the same way that the bed and unit inventory and utilization would be missing until you go in and upload the APR CSV. So these forms here, these steps here are going to be blank until there is some data to get pulled in. So the first thing that has to happen is that CSV APR upload has to be uploaded, and then that add button over on the right has to be clicked to create the program eligibility form. This is what the program eligibility form looks like. In most cases, you know, hopefully easy peasy, you just go in here, you look at it, you see, oh, all of the clients entered from homeless situations. They're all assumed to be eligible. Nothing needs to happen. Click save and go about your business. You don't have to enter any explanations. You don't have to enter any additional information. If people are entering from a non-homeless situation, though, a response has to be provided. So if someone is entering from transitional housing, let's say into a permanent supportive housing project, an explanation of how that person was determined to be eligible for the permanent supportive housing project needs to be provided. Same for other temporary situations, permanent situations, don't know, and data not collected. Talk a little bit more about the details in here. When you're providing an explanation, don't enter any client personally identifiable information. Period. Do not enter client PII. To the extent that you all are talking to recipients about filling these forms out also, we really encourage you and support you in reminding them not to disclose PII in the APRs. The expectation here is really to just provide a concise, brief description of how eligibility was determined and documented. So for example, if you've got 14 clients who entered from a permanent situation, just tell us what that situation was, right? Like just give us a brief explanation there. 10 people entered due to transferring from one permanent housing project to another, and 4 persons were eligible due to actively fleeing DV, right? So that's all that we need to see. That's all that your field office is looking for. And also, you know, I lost my train of thought there. A brief, concise explanation is what's needed to be documented here. If a participant did not want to provide their living situation, you would need to give an explanation of how eligibility was determined. So we know that there's going to be some situations where data wasn't collected or the client didn't want to provide that information, but you could still determine that the client was eligible for the project. Probably the best example is someone fleeing domestic violence, right? Like they don't want to disclose the situation they were coming from, but they're disclosing to you that they're fleeing domestic violence. That would be the explanation that you would want to write in the box here. The reviewer, when they're reviewing this form, if they want more of an explanation, they may send it back to you for more of an explanation. On the screen here, I know it's a little small, but on the screen here, let's say the first one you wrote, the worker didn't ask about the living situation. Well, the person reviewing this report might be like, yeah, that's not good enough answer. Like that doesn't tell us anything about how you determined that the client was eligible for the project. So sending it back to you to revise. You'll be able to see what you wrote the first time. The person who is filling this out will see the original response here. And can provide a little more information. So previously you wrote the worker didn't ask about it. Let's give a little bit more. So now we can say the client were fleeing domestic violence. Worker didn't ask them about it because of their immediate crisis. You know, something like that that just gives a little more of an explanation about why that data wasn't collected, but how you are still verifying that that person was eligible for the project. I think that is all I wanted to say about that at this point. Of course, if you have questions about it, please submit AAQs. They can go to the SAGE AAQ desk.
I do have one question for you live here, Meredith.
Okay.
Is the program eligibility form necessary for projects serving exclusively DV clients?
It is. If they're coming, so again, it's going to be about the living situation, right? So it's going to be which situation was identified at project enrollment, and that's going to be what populates Q15. And so then that's going to be what determines where they would need to provide an explanation. And they would simply just need to explain that they're serving people fleeing domestic violence.
Thanks so much.
Mm-hmm.
All right, Gwen.
My item is not nearly as exciting, but I also promise that it is not as scary as it sounds. I know specs updates in the middle of the year sound terrifying. This really, I don't expect to affect any of you. This is primarily a change that we were letting vendors know about. We just want to communicate it with you as well, so everyone has the same information. As part of the FY24 data standards updates, we updated V3 financial assistance to use the start date instead of date of financial assistance, and now it has start date and end date, which is great because it means when we're paying rent, we know what month we paid rent for. And when we're generating the services CSV, date provided is the only date field that is used for most services. It's defined in the specs as information date for all records in this file. Because V3 now has this different type of date, the start and end date are elsewhere within the services CSV. So we realized we didn't really have clarity on what that information date meant for all these different types of services. Came up because of V3, but we didn't have it for the others as well. So we just put together a little crosswalk saying date provided should be coming from this place for each of the different service types included. So bed night date, that's the date the bed night was provided. That's pretty straightforward. Most of these are. We've got lots of dates of service. We've got data for referral, data financial assistance. For V8, we just have information dates straight up. For V3, because that is the odd one out, if your system happens to have a field called date provided, which again is no longer required for this element, if they have it, they're expected to go ahead and use it here. If they don't have a specific field for it, we're asking that they just use the date the service was created. That is the only CSV spec change I've got for you today.
And it's a very quality one, so we appreciate that, Gwen.
Thank you. I appreciate you.
All righty. Next up, the Data Standards Interactive Tool back with Meredith.
I really am trying to get some questions answered, so thank you all for your patience. Okay, so let's talk about the Data Standards Interactive Tool. Can you, Jesse, tell me if you're seeing that or no? You're not seeing it.
Nope, still seeing the slide
Seeing
deck.
WebEx, aren't you?
Yeah, it looked like there was a slight delay in passing the presenter role, so maybe if you just do it again.
About now.
There we go. I'm seeing the data standards page.
Super. Okay, so again, hopefully you saw the listserv come out about this, but we were able to release the interactive data standards tool. You can find the interactive data standards tool on our regular HMIS data standards landing page here. Our friends at ICF have helpfully put a little new flag by it, so you can see it here. And when you click on the HMIS Interactive Data Standards tool, you're brought to this new landing page. where we've, in short, we've taken the HMIS data standards manual and we've broken it into we've just broken it into a different sort of format, and we have organized the information differently, where you can now interact with the manual in a different way. You can go into each of the different sections here. You can search it. We'll click on it here in a second, but you can find guidance by different roles. You can find guidance by programs, and we've expanded the guidance that's available a little bit more than just what is in the data standards. So we've linked to specific parts that we think are helpful for instance, a victim service provider, specific parts of the data standards manual that we think victim service provider agencies should be paying close attention to. But then we are also linking to other external resources. So when to use a comparable database, the decision tree that we all know and love so much, the comparable database manual. If you've got HMIS end users out here doing data entry, we're linking them to some specific parts of the data standards manual, as well as some of these other resources around client-centered approach to data collection, just some other resources we have available, different things out here for vendors. And then when we get into different resources by program, again, we're linking to relevant resources. So nothing necessarily new here, but really trying to help folks realize what's available to them by these different roles and these different programs. When you click on any of those basics, it's going to take you here. Again, this is where the interactive part of this really comes to play. You're going to see all of this should look very familiar. It is the data standards manual, but organized in a way you can hopefully navigate it a little bit easier. But then you can also come in here and do some searching. So if you want to look up chronic, like chronic health condition, chronic homelessness, it's going to give you the acronyms. It's going to just give you a little more information, hopefully make it a little more easier to navigate and find the information that you're looking for. So yeah, it's similar to the tool that existed previously, but it is just managed in a slightly different way. We hope that you find it helpful and useful. If you have questions or comments about it, please feel free to submit an AAQ. We do want it to be something that is helpful and useful to you all. So I think that's it, Jesse. I'm going to stop sharing.
Thanks so much. Okay. Now I want to invite Grant on to start this conversation about data exchange and interoperability.
Jesse, you can stay on this title slide for a second. Hello, everybody. Super excited to be here with you today. What we want to talk about in this next session here is really to talk about some exciting work and conversations that we've been starting. To give you guys some background and context here, HUD, the data lab, has been working with the United States Digital Services and HMIS vendors to really talk about how we can modernize data exchange and interoperability within HMIS, and really going through and starting these conversation pieces. So what we want to go through today is talk to you a little about what it is when we're talking about data exchange and interoperability, why we kind of want to pursue this, and a little bit about what we'd like you guys to do in order to help contribute and participate in this conversation as well. So we're super excited to kind of talk a little about where we're at today. If you can go to the next slide, Jesse. So in this slide, we're talking about like what is data exchange and interoperability. So when we're referring to this, we're mainly talking about these three main points. So it is the seamless sharing of data content and services among systems or applications. It is the ability of systems to work together to communicate and exchange information when necessary and use the information that's been exchanged. And it is the process of taking data structured under a source schema and transforming it into a target schema so that the target data is an accurate representation of the source data. If you go to the next slide, please, I'll pass it over to Aichi to talk a little bit about what we have heard from while we're moving forward with this. So for the elevated needs of frontline staff and direct service provider slide.
Yeah, thank you, Grant. Yeah, and as a part of, as Grant mentioned, to help connect the systems, we wanted to make sure that it really serves our users. And parts of that, we talked to various communities to understand from the frontline staff as well as direct service provider. And what we heard is that connected data between HMIS and other systems will really help, helping to illustrate clients' end-to-end user journey to help bridge the gap in coordinating care. And also for case managers, it could really help in improving efficiencies and quality of the service to really cater to the clients. Otherwise, we also know we really just want to be able to understand a single source of truth or unified source of truth when we think about data being exchanged between these service delivery. And then in terms of advanced data, informing improvements as well as to programs and systems. And we know we always have pain when we think about data quality. How do we prevent duplicated data entry? So if we can really connect the system and allow them to talk machine to machine, we can really go away from the manual transfer of information. And lastly, really like thinking about moving beyond the hash HMIS CSV as the only or primary vehicle of data transfer, because we know it's very good at bulk information exchange. But when we think about care coordination, we're thinking about how can we have more of that transactional level. And enabling HMIS to be more consistent in the field, just at the working level, as mentioned, to deliver care, and really illustrating that full ecosystem of system that exists in the COCs where clients receive assistance. So that's kind of what we heard, and I'll pass it over to Grant to talk about a little more detail.
Thanks, Jackie. Thanks, Jesse, for moving on to the why data exchange and ability slide. So really emphasize kind of why we're working on this. This isn't a new conversation that we've been having. These efforts have been undertaken by HUD in the past around HMIS data exchange, but we're really trying to emphasize and focus in on the needs of the frontline staff and focusing around the clients. So using this new idea of data exchange, not necessarily new, but this data exchange ability to really emphasize, to really make it easier to work with the client, make it easier to work with other systems, make it easier to not have to duplicate data entry, not have to jump from one system to another, really to reduce the burden of the data collection on people experiencing homelessness, as well as all the frontline staff. So we're really trying to leverage technologies to kind of improve that experience for everybody. If you go to the next slide, please. So with this, as we talk about data exchangeability landscape, as we talk about the different roles that we want everyone to have, these are the kind of the primary roles that we have. So with HUD, HUD has the policy and strategy and vision around this conversation. Then with the TA providers and the vendors, we kind of have two lines of support. The first one for data exchange and data strategy, that's support to COCs. So really, how are you going to implement this in your community? Support to the COCs, support with your governance, support talking about data sharing and privacy, all the things you need to leverage the tools in order to accomplish this. With the vendors, working with them to make sure that they have the technical functionality for it and the engineering and capacity needs for it. So the HMIS vendors have the technology and the tools, and the TA strategies to kind of support y'all with everything we need to implement it. What we're kind of looking for all of you and looking at the HMIS leads and system administrators in the communities is to really lean in to understand how you can leverage this in your community, right? Define, identify the use cases that you might be able to leverage this for, and kind of think through operationalizing all this technical functionality. So with all of you, it's really thinking about how you want to use this in your community and what you might need to be able to implement this. I'll pass this back over to Aichi for the next slide.
Yeah, thank you. And just letting everybody know, this is a journey, right? We want to really get to a connected ecosystem to really support seamless coordination across COCs. And we're just starting. And starting from where we really want to see how we can get direct service provider and frontline staff. And first part is just to understand your client's journey without having the access of multiple systems, right? And that's part of where we're talking to vendors, understand what's technically possible, looking at API options and API references to allow that to really be enabled. In the long term, what this can bring is perhaps allowing one unified data entry to qualify for multiple things, understand maybe additional information through self-service, maybe from a client level, and then really thinking about how to improve that real-time availability of information on top of just having these periodic bulk updates. Yeah, thank you. Next slide. So just to re-emphasize, some of the things that we're looking for, from each of you to start thinking about. I think one is just thinking about talking to frontline staff, with your providers to identify the use case as we talk about more around the client level transactional information data sharing. and share these use cases so we can really help develop these connected reference through APIs and to further serve our users. You can email some of these feedback and information you find through the HUD Data Lab, and I think Grant can share the exact, I think we have the exact email as well. And on top of that, work with your COCs, discuss specific data sharing needs for frontline staff, direct service provider. Start thinking about how to make that operational. What is some of the legal groundwork that needs to be there in terms of agreements, leveraging existing agreements, and using this additional tool to really build that connected information and tackle any technical challenge that comes along the way. Anything else you want to add here, Grant?
Just one more thing. Thanks, Aichi. Just really wanted to emphasize for you guys that this is the very beginnings of this conversation, and we're really excited about this work, and we really want you guys' voice to be part of it. So really encourage all of you to think through and reach out to the data lab in the email that we were going to be sharing, and let us know kind of what use cases you can see for, as well as any other kind of feedback and things you think might be useful as we think about developing this and introducing it into the HMIS space.
Great.
All right,
Thank
Jesse,
you. I think
back
that's
to you.
all we have.
All right, thanks so much. Alyssa.
All right. Happy Wednesday, everybody. Kind of building off of where we just ended our last discussion, we're going to talk about data sharing and data sharing agreements. So if we go to the next slide, just wanting to level set that we do have whole NHSDC sessions about data sharing, privacy, and security. So really, we're just touching on this at a really high level today. Similar to the data exchange and interoperability and kind of grants level setting, this is not a new discussion. So we're touching on this at this moment in time for a few different reasons. Going back to the topic that we just discussed, sharing data about people experiencing homelessness across systems of care, to coordinate care, and to really serve people holistically is an important reality in our world. I think this was really highlighted as communities implemented coordinated entry. It was also reemphasized during COVID response, and as we've really prioritized authentically partnering with people with lived experience of homelessness. I think I say this every time I talk about data sharing. People experiencing homelessness are whole humans, and homelessness is an experience that they're navigating along with all of the other experiences and realities that make up their whole selves. So we also recognize that the world continues to change and shift. And we also see that jurisdictions are navigating very real political and local environments that other people, and we understand that the data shared from HMIS needs to be protected from being used against the people the data is about. Often when we talk about data exchange and interoperability, one of the first barriers that is brought up in those discussions is the data sharing piece. So really just recognizing and acknowledging that. The 2004 Data and Technical Standards serve as our baseline for HMIS privacy and security, and operationalizing these as our baseline while also recognizing that they're, going on 20 years of technological advancement between then and now. It is really critical as COCs implement and update policies and procedures about data privacy, security, and sharing. We also really want to just take a minute to re-emphasize and remind everyone of their responsibility and the role that they play in protecting client data. And when we talk about data sharing, we're not only talking about sharing data with other systems of care or even external partners, we're also really talking about those involved with the homeless response system and HMIS specifically, such as service providers, COC leadership, and those supporting the HMIS implementation itself, such as HMIS vendors, and all of you as HMIS leads and system administrators. So if we go on to the next slide, when we're sharing clients' personal information, privacy and security protections must be in place. So at minimum, again, alluding back to the 2004 Data and Technical Standards, that's our baseline. They have to meet those minimum requirements. We'll talk through other potential rules and regulations that may impact what is included in your policies locally in a second. I think this came up during a recent one of these calls, and just wanting to reiterate here that clients cannot be denied services they would otherwise qualify for if consent to either collect or share information is not provided. and just acknowledging that collecting and sharing data, again, that we talked about a couple months ago, they are two very distinct concepts, and a client can decline either or both of those. Everyone involved with or touching HMIS data must understand those privacy and security protections, and this includes the people that are collecting the information from the client, even if those people are different from the people entering the data into HMIS. It also includes the people who receive the data from HMIS for the purposes of research, evaluation, analysis, again, that coordination of client care, and this includes the people who provide our software support and those who administer the HMIS. So everyone has a responsibility here. So if we go to the next slide, the 2004 Data and Technical Standards refer to PPI, or Protected Personal Information. In more recent years, there's been a shift to referring to it as PII, or Personally Identifiable Information, which aligns more across other systems of care. When we're referencing PPI or PII in these conversations, they are synonymous. As mentioned earlier, the 2004 Data and Technical Standards, again, serve as that baseline for COCs related to privacy and security protections. If there are more stringent guidelines, regs, or other laws, either the COC as a whole or individual service providers must adhere to, those need to be incorporated into local policies. Quick definition on PII, it is any information maintained by or for a covered homeless organization, or CHO, about a person experiencing homelessness that identifies either directly or indirectly a specific individual, can be manipulated by a reasonably foreseeable method to identify a specific individual, or can be linked with other available information to identify a specific individual. That is coming straight out of the 2004 Data and Technical Standards, just replacing PPI with PII. There has been some discussion over time about what indirectly means, or how much additional other available information would be needed to consider any given piece of information PII. I think this has often been related to the hashed HMIS CSV and how unidentifiable that file truly is for, a small jurisdiction. But this is why ensuring strict privacy protections are in place, and all responsible entities know and agree to what those protections are. That is critical. So if we go to the next slide, I referenced some additional rules and regulations that could potentially come into play for you at the local level. So we've talked about the 2004 Data and Technical Standards. They serve as the baseline standards for collecting, using, and disclosing data in HMIS. There is the Coordinated Entry Management and Data Guide, which was published in October 2018. It's not necessarily regulatory guidance, but it expands upon the 2004 Data and Technical Standards within the context of coordinated entry, and really how to operationalize sharing data for the purposes of operationalizing coordinated entry. HIPAA, or the Health Insurance Portability and Accountability Act, governs how very specific health providers can disclose data. I just want to mention here that to be covered by HIPAA, a provider has to be billing insurance electronically. So I had a conversation with somebody recently that is much more versed on HIPAA law than I am. She used the example of a private practice therapist that doesn't bill insurance, but is providing treatment, is not covered by HIPAA because they are not billing insurance for that treatment. So I just want to mention that there have been some really great developments within the HIPAA space lately. I think I saw something about a webinar soon about that, but there's also some additional pieces that we're looking at, specifically as it relates to how HIPAA covered entities can share data with the homeless response system. So we are hoping to have a product available soon, and also facilitate a discussion about an FAQ that was actually released back in 2020 by HHS about how data can be shared between and by HIPAA covered entities with homeless service providers. So that is exciting, because I know HIPAA can be difficult at the local level. 42 CFR Part 2 restricts how drug and alcohol treatment programs disclose client records. And then both the Privacy Act and the Runaway and Homeless Youth Act require written consent to disclose client records. There are also a few acts to be aware of related to domestic violence survivor confidentiality and data sharing, including the Violence Against Women's Act, the FIPSA, this slide is interesting, Family Violence Prevention and Services Act, and the Victims of Crime Act, or VOCA. VSPs cannot enter identifiable information into HMIS, and they must use a comparable database for specific funding streams. There are already existing resources about comparable databases, and I think a few months ago, a couple of calls ago, there was a section where we talked about a pending VSP COC data strategy that is moving forward and will also be available soon. You all are working within different states and communities that may have additional privacy laws that may also impact how data in HMIS can be shared, so it's important to know and have a lens on those as well. So if we go to the next slide, this is one of my favorite graphics, actually. It is recreated from the Coordinate Entry Management and Data Guide. Communities have really used this to determine whether they need a written HMIS release of information to use or disclose data. We encourage a review of the privacy notice on a regular basis to make sure it still meets your local needs and covers the way you need to use and disclose data. And a reminder that shifting away from using a written HMIS release of information does not mean that data can be shared for any reason at all. Uses and disclosures that can be covered under a privacy policy without the need for an ROI must be in the 2004 Data and Technical Standards, going back as our baseline, and they need to be included in those standards as mandatory, permitted, or additional uses and disclosures. If the use or disclosure is not listed in the 2004 Data and Technical Standards as mandatory, permitted, or additional, and it's not in your privacy policy, you have to have client consent. And you can't include something in your privacy policy that is not in the 2004 Data and Technical Standards. So, for example, if a local newspaper were to contact you and ask for identifying information from HMIS about people served in a specific project, that disclosure would require written client consent because it is not covered in the 2004 Data and Technical Standards, which means you can't include it in your privacy policy without getting written client consent. So if we go to the next slide, this just lists those different mandatory, permitted, and additional uses and disclosures that are written out in the 2004 Data and Technical Standards. So I think this permitted section here is what tends to be, I don't want to say a sticking point for communities, but when we talk about whether or not a release of information is needed, a written release of information is needed, we're often talking about a written release of information specifically for that first bullet point under permitted. So to provide or coordinate services to an individual. That's typically what we see releases of information being used for. There's also often situations where the privacy policy actually is taken and it's like language verbatim from the 2004 Data and Technical Standards, which also says that you can use or disclose client information for all of the reasons below, and anything other than that needs written client consent, and that to provide or coordinate services to an individual is often included in that section in the privacy notice, which means that there could be a discrepancy in how a community is using a release of information while also covering a permitted use and disclosure within their privacy policy. So again, like looking at, and we'll look at the different types of documents that may need to be reviewed when it comes to data sharing, but just making sure that when you're reviewing your privacy policy, that you're also reviewing, for example, if you still use a written release of information, that in addition to your privacy policy, to make sure that there aren't any discrepancies or conflicting information between and among those documents. So if we go on to the next slide, this is just a reminder of all the different entities that could potentially have access to HMIS data, and that proper consent agreements policies should be in place for all entities involved with and responsible for accessing HMIS data. So the COC, the HMIS lead, the HMIS participating providers, as well as the non-HMIS participating providers, especially if there's data shared from HMIS for the purposes of something like I don't know, coordinated entry case conferencing where you may have non-HMIS participating providers at that table. The HMIS vendor, funders, media, researchers, and other key partners. One more slide, I think, for me, that we have talked a bit about privacy policies and privacy notices was mentioned in that graphic that we showed, but there are often several different documents that could be relevant to incorporating into your data sharing governance. I consider these like a suite of documents. And again, making sure that all of them are reviewed together and that they don't contradict each other. And also looking at how they're aligned and really supplement each other. So there's the potential, and not saying that all of these are required to be within your community. There's often situations where the privacy policy is actually built within the HMIS policies and procedures, for example. So if your HMIS policies and procedures already incorporate a privacy policy and or security policy, you don't necessarily need them as standalone documents, but if you do, again, just making sure that all of those different documents are reviewed in tandem so that they aren't conflicting with each other. I think that's all I've got, Jesse. I don't know if there's any questions that came in or any,
Yeah. Could we go back to the comment that you made about like the example with a private therapist not being a HIPAA covered entity? Could you just reiterate that one more time? A few questions came in around that point.
Yeah, and William, I don't know if you're still on this call, but that was coming from that conversation with Maya last month, maybe. And really the example that she used was, I mean, to be a HIPAA covered entity means that you are billing insurance for the treatment that you are providing. So if you are a licensed therapist and you are providing treatment, but you aren't billing insurance, like you're doing a side work and have patients who have found you somehow, but are not billing their insurance for it, they're paying you out of pocket, for example, that provider is not HIPAA covered because they are not billing insurance for that treatment, even though they're providing treatment to those patients.
Got it. All right. I'll leave the rest of them to you to sort out in the document itself with more specific answers, but thank you. Okay. William, would love to hear from you about why it is that we don't just have one national HMIS.
All right. I've never heard this question before, so we'll take a pass at it. Just kidding. We hear this question all the time. So why do we not have a national database or national HMIS? There's a few reasons. One, let's go back in time to history a little bit. Congress was the one who said, go and get unduplicated data on everybody experiencing homelessness. That was their charge. I was back in around 2000. We said, sure. We started actually with a national database as a pilot with about 4 or 5 communities, and it was a disaster. So we started with, let's see what works out. It administratively was very cumbersome. The system was government procured, so it had all the fun of like extra layers that made it difficult to upgrade and was super slow. So nobody that participated in that pilot enjoyed it, and it kind of failed there. Perhaps the bigger reason, though, has to do with the reality that at least in 2000, there was an ask or request by communities that there not be a national database of people experiencing homelessness. With all of the fears that you can imagine, right? If there's a national database, will that mean that anybody in the federal government can access it? Does it mean that it's FOIA-able and people can use it for any purpose? What gets disclosed, what doesn't? We live in an era now where in some communities, if you release gender information, for instance, you may actually endanger people you're serving. That's also true of back in 2000, our domestic violence community, they did not have quite the same protections as they do now. So that was a big concern. Are we going to compromise the confidentiality of survivors? So that's a really big and important concept here of that idea of not having a national database of people experiencing homelessness with identifiable information resting at HUD. So we honored that. as we kind of move forward, we also found that many communities wanted to do some of their own things anyways. They wanted the flexibility to be able to add elements as needed for their local needs. And so that those are kind of the core reasons we ended up in the space of no national HMIS. I will say we're in a space where we probably won't change that, but we are investigating different ways to think about how we collect data. It's not 2000 anymore. People may have different thoughts around the easeability of reporting and looking at reporting in a different way. We are looking at all of those things. But again, to reiterate, you probably will not see a national HMIS for the reasons stated above. So I love the question here. Hopefully that answers it for some of you who have had that burning desire to know for a long time. And Jesse, I'll turn it back to you.
All right, thank you so much. All right, so I'm going to invite Ureli up. We want to know what types of other questions we could answer in the future.
Thanks, Jesse. So we've been doing About Why segment to give folks a chance to hear from HUD about why things are the way they are. We've heard from HUD about why they don't have data quality benchmarks across the board, why it takes so long to make major announcements, and why it takes a long time to post materials. So we want to hear from you guys. What questions would you like to have answered in future meetings? Give us an idea about what why questions come up for you in your day-to-day. So Miriam, could you pull up we're going to do a Slido for folks to share their feedback with us. There we go, should be popping up now. Perfect, yeah. So we're just curious, what would you like to hear from HUD about future meetings regarding things that you might be curious about? I'm gonna give you guys a minute. Let me see if you coming in. Awesome. So, yeah, these are really good. Why do the data studies need to be changed so frequently? Right. Yep, keep them coming. Why is certain data collected? Awesome. Certification system. All right, so these are really good. We're going to work on incorporating these into upcoming webinars so that we can get answers for you. Why are there so many strings attached? Good question. All right. I don't see any more trickling in, Jesse, so I'm going to hand it back to you.
All right, sounds good. Thank you. And as always, If you have other information that you would like us to know, whether you have a suggestion for an agenda item or whatever, you can send that to the HMIS email address, which Ureli, could you drop that in the chat when you have a quick second? Thanks so much. Okay. All right, that brings us to the end of our content. So per usual, we do try to let you know of anything that was recently published to make sure, just in case you didn't see the listserv. So in the most recent thing was that project cost calculator back in June, although we're still in June. So there you have it. Okay. We will see you again July 18th. Reminder, well, it's usually the third Wednesday. This time it's going to be Thursday, the day after the third Wednesday, which is probably the third Thursday, but I'm not sure. I don't have a calendar in front of me. So just want to remind you all that you can save the chat if you'd like to do that. We will be staying on for a few minutes to make sure we get the questions answered that have come in. And then before we end the call, I will jump on and let folks know that we're, give you a 1-minute warning so you can save the chat at that time. But with that, Cindy, I did want to invite you back up to the front here for a moment. Although actually it's your first time, you haven't even been up yet. So this is your debut.
Wonderful, thank you. So it is my honor to close today's meeting with the dad joke, or in this case, a mom joke, also fine. And it is, why do seagulls fly over the sea? And I'll give you a few beats to see if anyone might have heard this one before. Have any ideas? Because if they flew over the bay, they'd be bagels.
Oh, nice. Thank you so much. All right. So as I mentioned, we're going to go on mute and go off camera, get the rest of the questions answered, then I'll pop back on right before we end the call so you can save the chat. Thanks.